Welcome. This is Share Your Story Renama, and I am your host, Dr. Perfecta, the Pain Healer. Share Your Story with Renama features real life struggles women face with their health. It's a means to educate one lady at a time about several health challenges the women folk face, while emphasizing that they are not alone and their pain is valid, whether it is big or small. In today's episode, we will be sharing a true life story of a lady who lost over 3 million naira worth of opportunities due to a health challenge. Let's dive right into it. Hi, Anonymous.
Hi, Dr. Perfecta.
All right, thank you so much for choosing to share your story with us.
It's my pleasure.
All right, so tell us about your story. When did it start and how?
Whoa, I have a couple of health stories, but I'll pick one, and that's the issue of constant dizziness, fatigue, tiredness. I dealt with it for at least counting that I became conscious was 7 years ago. So I would notice that unlike every other normal person, if they should wake up, they could stretch easily and not feel any sort of lightheadedness. But if I should try that, I would just feel so lightheaded. I would feel dizzy. And that would mean me having to, stay back in bed for a couple of minutes before I could get up to go do anything. I might be moving around the house to do something, and then all of a sudden, if my family members see me trying to rest, they know, oh, the dizziness is here. So it's something I just, over time, began to just live with. And I started counting consciously for 7 years. So that's what I dealt with for at least 7 years of my life.
Oh, wow. All right. So by dizziness, what exactly do you mean?
Okay, I know that the average Nigerian mixes dizziness and feeling sleepy. So let me explain dizziness. Dizziness could just mean you're becoming lightheaded, or you're feeling like your head is spinning.
Okay.
So that's dizziness.
So you're trying to tell us that for 7 years, that's as much as you can remember.
Yes.
You felt like your head was spinning every morning when you wake up.
It's not just when I wake up. If I do anything maybe not really out of the ordinary, maybe I just get into action, all of a sudden I would feel like I'm dizzy and I just have to stay back a bit, just sit down and relax a bit before I can get up and start doing what I need to do. So in the morning, I would not dare stretch when I wake up because dizziness is coming. Then about 2 years ago, it became worse. So every single day, no matter how long I slept, I would wake up with a serious case of the same dizziness, now tiredness, fatigue, headache, like every single day for at least 8 months, because it became something I got used to. I'm not the kind who loves taking medications.
Right.
So I just knew this wasn't a thing of medication, but it never occurred to me that I needed to really take it up seriously, because it's this thing of being used to pains. And so it just continued that way for at least 8 months.
Right. You see, the same thing you talked about being used to, it's one of the reasons why I started this podcast and generally doing what I do, because I think that's the problem. Like what you said now, you kept quiet for that long because you already got used to it and you just thought that it was something that you had to deal with. So it was the silence that actually probably wasn't what it is that you dealt with. Because if you had spoken out to maybe any health practitioner that you were your health caregiver as at that time, you would have probably gotten a solution to whatever it was that you were dealing with. All right, so tell us more about when you had to deal with.
So you mentioned health caregiver. I never had any. Okay. The case with the African society, the average African society, is that people are actually looking for food to eat. They're looking for something tangible to even wear. So the average African, as far as I know, doesn't necessarily have time to care for their health.
Wow, that's true.
So,
I mean, I'm saying wow, but I mean, like, the way you put it, that's sort of true.
so the average African is thinking, at least I'm a Nigerian, so I'll say the average Nigerian is thinking of, oh, I want to eat. So nobody's going to talk to me about any health practice or me going to any doctor. And because of that, it's something in my subconscious that never made me really take it seriously. And it was actually around the time when I was practically broke. So back to back, there were times I would go on endless sessions of not eating,
Mm.
and it could go on for days. Like I've not had breakfast as at 3 p.m. or even 5 p.m. sometimes, and it just went on for days. Sometimes it could be. There was a time that in my life that as at 3 p.m. I wouldn't even feel hungry, or 2 p.m. I wouldn't feel hungry. For someone who used to wake up at a point in time in her life that she would eat as early as 6 a.m. and she was ready to eat because she was going out then. I became a person who, because there wasn't enough to eat, I wouldn't eat until that late. So if there wasn't something to eat. So for someone who doesn't have enough to eat, that person would not even be thinking of going to seek medical advice because you're thinking, oh, they'll charge me so much money. So I never had a healthcare practitioner. And another problem is too often some people just go ahead, they don't even when you share your health issues with the so-called healthcare practitioner, they end up just telling you something so random, like
Mm.
what every other person will tell you. Take malt and milk as often as possible, right? So I wasn't getting any better because that actually wasn't the problem. So that's more like it.
All right. So, right, like you said, malt and milk is a short fix, and you would have had to take so much of that to constantly keep you, active and all of that. But that wouldn't have fixed what exactly was wrong with you. So I want to ask you, because I can't put a number to how many malts and milk you must have taken in your lifetime. But what has this everything that you had to deal with? What did it cost you to journey through life with it emotionally, physically, and even financially? But I'd like you to start with emotionally.
That thought of um, if I should work too much now or I could just start feeling dizzy anyhow, that thought at the back of your head could make you get so scared of going to places you know you should be because you'd be thinking, if I should go visit a friend now that I really know I care about, and then I tell the people I'm feeling dizzy to look like this one is lazy, she doesn't want to do anything, and I'm actually dizzy. I'm dizzy. I'm trying not to exert too much energy. Yes, I want to do the work, but I can't. Or look at getting it. There was actually a time that I am jumping ahead. This was after I had consulted with you, and then we had known the issue and everything. But I did not come back to ask you if I could just jump on and start fasting like I used to. And then I went on this 30-day fast. Yes, there were some that weren't, there was food fast in between. And on the 30th, which was the last day of the fast, I regretted ever doing it. Now, yes, I'm a Christian. I'm proudly Christian. I believe in praying and fasting, and then it's something I really hold on dearly to. But because it took me time to discover that I had been breaking down my own immune system because of lack of nutrition, enough nutrition for my body, and all of that. So when I started getting treated by you, I got to that point where I did not come back to consult you that, oh, can I just join this fast, because I thought, oh, everything is now fine. I no longer feel dizzy. But that day I regretted it because I was meant to go to a very kind of high level networking event. I was meant to be the presenter at that event. I was well dressed for that event and everything was set. And just because I got into, yes, motion sickness was also a part of the issue. That was a constant K. So every time I got on a bus or in a vehicle, if it's enclosed, if it's not properly ventilated, like well ventilated beyond what the average person would be comfortable with. I would feel dizzy. I couldn't take cabs with people. Like, okay, let's share,
Go
let's
Dutch.
go Dutch on the transportation fare. I couldn't do it because I would make other people uncomfortable. So it meant that many things I could have done with other people, I couldn't do those things. That event, I was seeing the event center, like, okay, maybe not literally seeing it, but I was less than 5 minutes away, but I obviously wasn't able to make it because all over me, it's written that I was worn out. Why? I had gone into that fast and all of that. My body wasn't ready for that yet. And because the whole of my body was almost shutting down, I had to go back home. So I live on the mainland. I was going to the island. I was already on the island just less than 5 minutes away from where I was going, and I had to miss that networking event. It's the height of one of the things that really has hurt me in my life because of this issue of dizziness, tiredness, and everything.
Wow, wow. I can just imagine that. So, I don't know how that must have hurt you because you said it really hurt you, but I feel like I can relate to it because that would have meant a lot to you at that time, hosting the event. I can imagine if a presenter is not present at an event that she is meant to host, then what would have been the fate of the organizers, right? So that would have been a lot for you to handle at that time. And I'm so sorry that you had to go through all of that. And like you said, you're a Christian. Fasting is not bad in itself, but you need to know your health challenge so that you know that this is either aiding what you want to achieve, or this is, this is going to like maybe cause your health to deteriorate further. So now financially, I think you've already touched a bit on physically because that already affected something physically, right? So financially, I know you cannot place a figure to it, but let's even start with the malt and mix situation. How many cartons so do you think you'd have consumed down to, having to go, 7 years? That's what you think you can even place to it, but that's not the entirety of how long you dealt with that. That's a lot. Can you just like enlighten us a bit on what it must have cost you financially?
I'm trying not to laugh about the malt and milk issue because that meant I would literally have to go almost everywhere every single day with a can of malt drink and maybe a tin of milk everywhere I go. It meant that I couldn't travel light. And if I would place an amount on not just the malt and milk, but opportunities that I had lost because of
Mm.
that, we can't look at 3 million naira. We can't, because if I bring all of the years together, like 3 million naira is just it's let's just manage 3 million naira.
Right. You see that, like she said, she cannot put an actual figure to that, to the expense that panned throughout 7 years. This is to say that the more you delay going to check what's up with you and how it's actually up, what solution can be there, the more the more opportunities, the more money that you actually lost, right? So I was going to ask now that if you had, okay, so what are you doing now to get to understand yourself better, get better results with your health? And let's start with that before I go to the next question.
Well, I love that question because I would say it became a turning point in my health because I mentioned the issue with being low on nutrition, and I know that the main thing I kept doing then was, okay, I would check my weight every now and then, and I discovered, at least from the internet, that I had a low BMI, so which, and it was quite low for everything about me, my age, my height, my everything, and I knew that I was underweight, but I didn't understand how terrible it was until I consulted with you, and then I got to know what the root of the problem was and what I needed to do in line with my own body type and everything. And each time I started feeling those symptoms or whatever they're called, I know this is what to do to get me back on track, and that has really been helpful.
All right. Thank you so much for saying that, by the way. I was going to ask you, this is the last question. What advice would you give everyone listening to this, every lady? What would be your advice to them?
Well, don't just assume that pain is natural or it's something you're meant to hold on to because you're a strong woman. The show of strength is not by you holding on to pains that are not necessary. And I would advise that you seek medical advice, not just from people who are saying they know what to do, but to an extent, make sure you've seen their track record to an extent, and then, well, just know what works for your body, but make sure it is in line with proper medical guidance.
All right. Thank you so much. That was beautiful. Know what works for your body and it's in line with proper medical advice. So thank you so much again for choosing to share your story with Renoma.
It's my pleasure.
Right. Bye. Disclaimer: this is based on someone's true life story, and the instances mentioned might not necessarily apply to you. Seek to find out your specific health situation and solution from your healthcare provider or any other certified healthcare provider. If you'd love to share your story with Renoma, visit www.renomaholistichealth.com/SYS form and follow us on all our social media platforms at Renoma Holistic Health. Till I come your way again, remember, your body is not a storehouse for pain. Don't get used to it. Don't nurse the pain. It's not your baby.